Hello, and a warm welcome. Good afternoon, good evening, good morning to you all, wherever you are. And welcome to this Knowledge Lab session hosted by WaterAid on female-friendly toilets in public and community spaces. So a warm welcome to you all, and a huge thank you as well to the ADB Gender Equality Group for this opportunity to share our resources with you and discuss as well how they can be used. So my name is Therese Mahon. I'm WaterAid's Regional Programme Manager for South Asia, and I am joined by some expert colleagues and speakers who I will introduce to you as we move on with the session. So I'm requesting my colleague Minu to share her screen so that we can share with you the session overview and objectives. Thanks, Minu. If you can go into presentation mode, I can see the, that's it, yeah. Okay, super, thanks. The next slide, Minnie. Great, so the objectives for today's session are quite simple. So we want to share with you the female-friendly toilet guide, which we produced in collaboration with UNICEF and Water Sanitation for the Urban Poor, and for us all to have a common understanding of the importance of female-friendly and accessible toilets, to understand what the key features are and how we can collectively work to increase gender sensitivity in town planning, specifically around sanitation. And then colleagues from different countries are going to share how they have been applying this guide and to discuss together how can this be further applied for assessing, planning and designing public and community toilets. Next, please. So following this very short introduction, my colleague Minu, who is the Regional Strategic Support Manager at WaterAid, we have a few icebreaker questions for you, which we're going to use Mentimeter for. So please have your mobile phones ready for that. And then we have a series of presentations, an introduction to the guide, and then 3 country presentations from Nepal, India, and Bangladesh. We're also delighted to have with us Dr. Tariq Bin Yousuf, who is Assistant Chief Engineer from Dhaka City Corporation, and he'll be sharing his reflections on the work in Dhaka. And then we have plenty of time for questions, answers, and discussion with participants, and then a few closing remarks. So next, please, Minu. Now we get on to the short interactive part. So over to you, Minu.
Thank you, Therese. Good afternoon and good morning to all. So if you would kindly take out your phones, or if you're on your laptop as well, I'd request you to go to www.menti.com and enter the code. The code is 30422196. It's visible on the screen, or you can use the QR code. If you use the scanner on your mobile phones, you can scan and enter using the QR code.
Okay. Where do you want to use things?
Great. Just in 5 seconds, I will start the Menti session.
Yeah. Go ahead.
Hoping that everyone has been able to join. You can join on your mobile phones or on your laptop as well. The code is 304222196.
Yeah.
Okay, let's start. The first question is, what country are you joining from?
Let me actually ask one question. So if it's not actually that,
You should be able to see a box to enter your answers. We see the answers coming in. UK, Philippines, New Zealand.
It's called focus country, something like that. Yeah. How about that?
Has everyone been able to join the Mentimeter exercise? The code is at the top of the screen. It's 304222196.
I've also posted in the chat box as well, but I got one number wrong in the first time. It's in there again. Okay. So looking at the answers, I think for most people it's afternoon and evening. Let's go on to the next one, Minu.
Thanks, Therese.
Yeah.
So we have the second question here. Which sector or thematic focus is closest to your primary work area? Let's see what comes in.
Ah, this is interesting. Quite a lot of variety here. So predominantly at the moment, predominantly wash. Are there any others would like to join in, see if we can increase from other groups? I hope you've seen the link in the chat box to join in if you were not able to get on to start with. But great, we've got a really good range here of gender and WASH, education, those working in economic development and the environment. So a lot of great expertise. And thanks, Emmy. Yes, if you're not able to join the Menti, then please just answer the questions in the chat box as well. That's great. Okay, super. But it's fantastic. We've got a mix when it comes to the discussion. It's great to hear from all these different sectors, how we tackle this issue together. Let's move on to the next one, Minu.
Thanks, Therese. The next question for this part is, have you ever missed out on something or had to change your plans due to inadequate toilets in public places? We would request everyone to please respond as per your gender. Thank you.
Okay, so a lot of our respondents so far are female, and they have all experienced having to change their plans or missed out on something due to lack of female-friendly toilets. And so far, few male respondents, and equally some have and some haven't missed out or had to change their plans. But for our female respondents, it's 100% yes. So I think this is something that this is a topic that we can all identify with. Great, thanks Minu. we can go back to the presentation now. We'll be coming back to Mentimeter later, so so do keep your mobile phones ready. It's great to have this interaction. And I'm going to hand over now to my colleague, Priya Nath. Sorry, let me come back on screen. And Priya is WaterAid Senior Advisor for Equality, Inclusion and Rights. She's worked on equality and inclusion issues for over 12 years, and she's passionate about social justice. And at WaterAid, she supports our teams across the organisation to ensure our work and organisation is more equitable and inclusive. Over to you, Priya.
Thank you, Therese, and thank you everyone for your participation so far in this, in the polls, and also for joining today. So we're going to start off by showing a video. So Minu, if you could please hit play on the video. Thank you.
Sanitation is a basic need and a human right. But 2.3 billion people still lack a basic toilet at home. And there are not enough public and community toilets in most cities. Existing ones rarely meet the requirements of women and girls. They have different sanitation requirements from men, for instance, during menstruation, pregnancy, after menopause, and for privacy in general. And they face higher risks of harassment and physical and sexual assault when using toilets outside the home. They often have most of the responsibility for caring for children, older people, and people with disabilities who may need assistance when using the toilet. But governments and city planners can improve this situation by putting a focus on ensuring public and community toilets are female-friendly. Female-friendly means public and community toilets that are safe and private, meet menstrual hygiene and other hygiene requirements, accessible to all, including people with disabilities, well-maintained and managed, affordable and available when needed. Women's views on sanitation are often ignored in city planning, possibly because most planners are men. The key to success is the participation of women in the planning process. The Female-Friendly Public and Community Toilets Guide helps city authorities, planners, and NGOs identify areas that lack public and community toilets and check if existing toilets are female-friendly. It also provides real examples of how to upgrade existing toilets, plan new ones, and involve female users throughout. Download the guide today.
Thank you, Minu. So as you've just seen, there is gender discrimination and human rights denial being experienced by women and girls daily because of this lack of access to private, comfortable, and convenient toilets. While toilets in the home are the ultimate solution, we know that women and girls need to move around, they need to engage in economic or education activity, and they just need to go about their daily lives. And particularly in cities and towns, they might be living in situations where individual household toilet sanitation remains a big challenge. So recognizing this, WaterAid, UNICEF, and the Water and Sanitation for Urban Poor carried out some research in 2018 to inform and produce an easy-to-follow guide to how to make community and public toilets female-friendly. This guide was designed to influence planners and decision makers and to help them to better understand the requirements of women and girls and respond to them effectively. So this presentation today will focus on public toilets specifically. Next slide, please. So what the guide does is it presents 6 broad requirements within which it provides essential and desirable context-specific features. These broad requirements are important for all toilet users. However, focusing on specific requirements on women and girls within these will maximize the benefits for them, reduce disadvantages, and it also meets the needs of men and boys. So these requirements are, A, that it's safe and private. So under these, we have features such as ensuring that there are separate entrances that are sufficient distance apart, ideally facing opposite ways, that there is the location is visible, it's private, and it's safe. So visibility, privacy, and safety are balanced. That there are caretakers there at all hours that the toilet is opened, and that those caretakers or staff are gender sensitive in their approach. That the cubicles lock from the inside and is made of a solid structure, and that they're designed to conceal the inside of those toilet blocks from passers-by. So ventilation systems don't allow people to hear or to see in. Another key requirement set out in the guide is around menstrual hygiene, health and hygiene requirements. So here we have access to water and soap, access to menstrual products, the disposal. It features what are good disposal options for menstrual products, thinking about things like hooks and shelves so that women who are entering the cubicle and dealing with menstruation have somewhere to put their bags, put their products. Also including things like mirrors, and also washing and bathing units, depending on the context. So maybe some bucket of water inside the cubicle itself for those dealing with menstruation, or maybe bathing units in particular countries where this is common practice or acceptable practice. Another area that it looks at is being accessible to all users. So under this category, we look and define some requirements around reasonable distance from locations where people are at or using, that there are accessible cubicles, so at least one cubicle in the structure is disability friendly and inclusive, that the path leading up to the structure is also accessible and does not disadvantage people who might be having sight impairments or maybe walking with canes or sticks or walking sticks, or using a wheelchair. And we define meeting the needs of people with disabilities by referring to national and global guidelines here as well. Another category is around affordability and availability, so that it's open when needed. There are enough cubicles so that there's a process for calculation of how many cubicles are needed per the standard size of that population. Another category that this guide goes into is looking at the maintenance and management. So this is looking at cleanliness, what is the maintenance schedule, what is the solid waste management arrangement, how is fecal and liquid waste management catered for, and that the whole structure is adequately managed either by the local authority or the relevant body providing that service. And finally, it also features a category around meeting the requirements of caregivers. So here we think about things like baby changing stations, around family-friendly cubicles, around breastfeeding stations, and ideally one in the women's section as well as one in the men's section. Next slide, please. The guide also suggests ways to make sure that the process of planning, constructing and upgrading or managing public and community toilets adequately involve women and girls and respond to their specific requirements. This is not exhaustive guidance, but a brief overview drawing attention to some aspects and to how to make the whole process more gender sensitive. There are also references in the guide for more detailed examples. The first step is to ensure that there's appropriate access for women and girls and those whose requirements are regularly ignored through participatory citywide assessment of the gap. So we suggest and we lay out how to do a citywide assessment of the gaps in community and public toilets. The aim is to answer the questions that are on the screen through the citywide assessment. This assessment and wider efforts to improve public and community toilets should not happen in isolation, of course. So it's important to try and cooperate and integrate this with initiatives that are already going on to improve household toilet provision or sanitation in institutions such as schools and healthcare facilities and in the workplace. And it's also to think about coordinating this with existing or planned work around urban planning, upgrading of informal settlements, etc. Next slide, please. as part of the assessment, we recommend that you can use something like this. It's a traffic light system where you can do a bit of mapping based on your assessments of where are some of the red zones in the city, where are the amber zones, where are the green zones. So where are the zones where there are no access to community or public toilets? Where are there's access but they're not female friendly, and where is there access to those facilities and they are also meeting these female friendly and accessibility requirements. Next slide, please. So
you have a minute, Priya. Thanks.
Sure. As I said, it's very important that these citywide assessments and the whole implementation process is gender sensitive. So one of the ways that we suggest in the guide that this is done is that there is more consultation with users. So as part of the assessment process, gathering the perspectives of the users of these public or community toilets, or the intended users, or those women and girls that could be using but are not using it at the moment because of the structure is not suiting their requirements, not meeting their needs for whatever reason. So consultation is a huge part of the assessment that we propose. And also, again, just stressing that this is not a standalone process and can be incorporated into wider city planning initiatives. Next slide, please, Minu. So now I'm going to hand over back to Minu, I think, for a poll, and then we'll look at some of this assessment in practice. Thank you, Minu.
Thanks, Priya. Heading back to Mentimeter. I hope everyone has gone back to Mentimeter on their phones or their laptops. Now we're at question number 4. What do you think is the biggest challenge in your country for inclusive public toilets? Try to answer in one word. I know it will be tough, but let's see what comes in. If you've logged out, the code is there at the top of the screen. It's 30422196.
Wow, so lots of issues coming up here. Some of the kind of practical issues about toilets not being available, not being accessible, but also some of the really underlying issues around not having land available, it not being prioritized, and even we're going down and down into the reasons why as well. So mindset and patriarchy, fantastic, lots of issues coming up here. And I think we'll perhaps hear some of these issues come out through the country presentations, but also look forward to hearing your comments and reflections when we come on to the discussion too. These are great answers. Operation and maintenance, yeah, lack of cleanliness, definitely this lack of recognition and understanding of the issue and the bias and cultural aspects that underpin the lack of availability or the lack of suitable toilets to be inclusive. Brilliant, thank you. This is excellent, and lots of people engaged in the Menti now, so that's great to see. Okay, so let's move on, and thank you very much to Priya for that introductory presentation to give you an overview of the issues and of the resource. We're now going to look at how this has been applied in practice, starting with our experience in Nepal. So I'd like to introduce my colleague Govind Shrestha, who's a policy specialist, senior policy advisor at WaterAid Nepal. He is very well known for advocating and for inclusive and better financing in the sector. And he's passionate about inclusive and democratic governance. So welcome, Govind, and we look forward to hearing of your experiences.
Yes, thank you, Therese. Yes, after the publication of female-friendly public toilet guideline in 2018, we mapped out public toilets in 4 municipalities of Kathmandu Valley in 2019 in partnership with a local partner, Guti. In order to ensure the ownership of the findings of the study, we formed a lead committee represented by deputy mayors of 4 municipalities. Under that committee, we formed a task force team comprised of senior officers and representatives of municipalities, National Federation of Disabled Network, Nepal Oil Corporation, and Department of Water Supply and Sewerage Management from our technical and financial. So, next slide, please. Yes, referring to the parameters and indicators suggested by the female-friendly guideline, we conducted an assessment. I'm not going to read out the details. You can see the details, the scorings of different indicators for different municipalities. I'm going to read out the key findings, only key findings. Out of 119 public toilets assessed, we found that all the public toilets were in very poor conditions, all scores very low. We also found that highest scores were for location and opening and closing times of the public toilets. We also found that the possible quick wins could be such as hooks, disposal systems, comfortable place for operator, and improving lighting in public toilets. Another key important findings we found was we need to have a kind of substantial work needed to create national standard for public toilets. 2 major methodologies we applied one was observation, and another was to ask questions from respondents. Next slide, please. Yes, after having the findings, we prepared 2-pager advocacy paper and also organized 1 dissemination event at the federal level, including the representatives of 4 municipalities and other key stakeholders responsible for public toilets. We also had a kind of continued lobby meeting with 4 municipalities for the formulation of the public toilet operation guideline, means inclusive and female-friendly public toilet guidelines. We also share the guide. We also share the guideline to the participants. One of the very interesting, observation during our presentation I observed was that most of the participants, get to know the first time about what is female friendliness of the public toilets. They knew about a kind of inclusive public toilets, but female friendly public toilets was a kind of very new for them. A separate space for babies. These are the very important points they noticed, and also we have been advocating at the federal government for the formulation of public toilet at the national level, so that it could be referred by all the municipalities of Nepal. Next slide, please. Yes. With this continued influencing and advocacy work with different stakeholders, we have some good outcomes. One of the study municipality, that is Kirtipur municipalities, has formulated and endorsed public toilet operation guideline. Kathmandu municipality has drafted a public toilet operation guideline. Another important outcome we observe was, is one of the social enterprise that is called Aerosan built 6 public toilets in Kathmandu municipality in guidance of Guti, that is our local partner for conducting this public toilet assessment. One of the 5 finalists out of 80 selected by the Sarpati Sanitation Challenge in the Stockholm World Water Week 2021 last August was Aerosan. You can see a lady. In one of these 6 public toilets, sitting in a very dignified way. She is an operator as well as cleaner of one of the public toilets. This is one of the very good achievements we have been seeing in these public toilets. And most of the recommendations and indicators we recommend from this public toilet guideline. We can see these indicators in these 6 public toilets. Definitely, after seeing these 6 public toilets, Kathmandu municipality has allocated 6 crore Nepalese rupees for the construction of public toilet. Another outcome is, yes, of course, Ministry of Water Supply has requested WaterAid for providing technical assistance to draft public toilet guideline. This will be a national guideline. Next slide, please. Yes, we also have some good reflections. One of the reflections is this guideline made us easier for designing schedules to map and assess public toilets. Another reflection is, as the focus of the mapping, this assessment was to explore the specific needs related to gender and inclusion. For example, person with disabilities, menstrual health. The tool was highly relevant to refer to other. Another reflection is the formalization of parameters recommended by the guideline into national standards can reinforce legitimization of the assessment and availability of facilities in place. What I'm trying to say is that now if we have a national standard referring to this guideline, then we can proudly recommend also some public toilets about, okay, this is your rating according to national standard. And the last one is definitely the public toilet has got priority in the sector to address slippages in open defecation communities, which is 5% in Nepal. That's why the guideline can help support the sector in realizing the priority into actions. The last one, last week, at the request of the Ministry of Water Supply and the leadership of Ministry of Water Supply, we conducted a highway public toilet assessment in Nepal. You can see the spots in Google Map. Red one is public toilets managed by petrol pumps, and the blue one is simply a public toilets. The key finding is the number of public toilet is not a problem. The key problem is the quality and inclusiveness of the public toilet. Thank you very much.
Thank you, Govind. That's really interesting. And so we have another Menti question for everyone. Over to you, Minu.
Thank you, Therese. Coming back to another Menti challenge for you all. If you could just log back in to Menti, we have question number 5. If you can see on your screens, which features are most often lacking in public toilets where you live?
Okay, we're getting a fairly even mix here, and the responses here, for those of you, the writing's a little bit small, so for inclusivity, I'll read out what we have. The blue column is about provision for disposal of menstrual hygiene products. The pink column is provision of accessible toilets for people with disability. The red column, which is the highest so far, is simply cleanliness of the toilets being essential. The yellow column following that, slightly lower responses, hand washing facilities with soap and water. And then fourth, less so, space to accompany a child, or for a carer to accompany a person with disability. So cleanliness standing out here as really the most commonly faced issue, but then provision for menstrual hygiene product disposal being the second, and equally then accessibility and hand washing as well. Thanks everybody, and do continue to share your experiences and challenges in the chat box along with your questions. Thanks very much. So let's move on now to our second country presentation. And for this, we're moving to India, and I'd like to introduce Amulya Miriyala, who's Policy Officer for Sanitation at WaterAid India. She leads our sanitation-related policy and technical support initiatives in India, and she's passionate about the environment, youth engagement, and equity and inclusion. Over to you, Amulya.
Thank you so much, Therese. And I would like to thank the ADB for giving us this opportunity. And I would like to extend my gratitude to Priya for setting such precise context. And in line with Govind's presentation earlier, I would just dig in a little bit further about the assessment that was carried out last year in the months of February and March in a central Indian city, wherein WaterAid India has assessed 14 public toilets in 6 different locations with focus on transit spaces. And we have also looked at 4 community toilets in 4 different localities across the city. And these 4 different community toilets that we've looked at are specifically in the informal settlements that predominantly use these community toilets within the city. To give you a quick summary of the assessment, one of the biggest highlights from this assessment was that all the studied toilets had very solid infrastructure, that they had a solid structural base, and they also had toilet structures in place. And there have been some active efforts to ensure accessibility within these toilet spaces, but there have been many gaps that have been identified, and with key gaps being that of female friendliness. As you can see in the assessment report that we have, safety and privacy is the component that has scored highest among the 6 factors that Priya had earlier mentioned, with the least being on the meeting requirements for parents and caregivers, as well as affordability, maintenance, and accessibility for users. As we have just seen in the Mentimeter responses, one of the key things that we have found to be very lacking in India were also that of public toilets being very unclean. And it's a very key distinction that we have seen was that it was often the public toilets that we have studied that were found to be unclean, whereas the community toilets, wherein the community held the responsibility for maintaining these toilets or taking care of them, given that they often do not have a toilet within their households or is often occupied. So within the community toilets, the cleanliness was higher when compared to the public toilets. And then accessibility, within accessibility, we have looked at multiple components. One is being its friendliness to persons with disabilities and elderly persons. And then its accessibility to pregnant women, newborn mothers, menstruating women, as well as persons with other locomotive disabilities as well. And then another component that we have also looked at was that of the toilets friendliness with transgender persons. And there have been some very key insights that have come out, which I will present in the next slides. And another component that we have also seen was that the community toilets as well as the public toilets lacked adequate solid waste disposal and the menstrual hygiene management infrastructure as well. And in spaces wherein there was infrastructure in place, it was either that they were not functional or that they had difficulties in accessing it. And a very key weak area that we have found within the entire assessment was its meeting the requirements of women, especially as parents and caregivers. And to note that, especially in India, it is still women who predominantly take care of their children as well as the elderly persons within the families. And some of the quick, easy wins that are short-term for this could be to put in hooks and shelves and soap dispensers and making sure that the hand washing facility is clean and accessible, and putting in instating fair user fees and providing PPE for the cleaners and providing fair wages for the caretakers are some of the key insights for us. Could we move to the next slide, Meenu? All right. So when we looked at the safety and privacy components, we, looking at the entry point or having doors and everything were not an issue for us. But when we looked at the location or the placement of these toilets, especially the public toilets, wherein in the transit spaces, the female toilets were often located in remote places, and that were often in dark alleys or areas that are surrounded by men, so that women do not feel comfortable accessing those. So those were some of the key insights that we have found, and responses that we have recorded from the users, that they do not prefer to use these toilets, or they feel uncomfortable using these toilets to their best potential, is because of either the caretakers not being women there, the caretakers being men, so they're not able to access the menstrual hygiene products, the vending machines that are in place, or the incinerators that are in place and everything, or that they do not even feel comfortable going inside the toilet because there are groups of men often standing there, or it is because there is no female caretaker or no caretaker at all. And there have also been instances that we have recorded wherein there have been stories, there have been cases of abuse that have been recorded within women when they were trying to use these toilets. And one of the other key findings was that there was no separate for transgender persons, and that oftentimes it is the disability friendly toilet is the one that is accessible for gender, that is gender neutral and is able to access for transgender persons, but was often found to be locked. Can you move on to the next slide? And when we looked at specifically the accessibility component of it, whilst we have noticed that there were ramps present at all the community and public toilets that we have looked at, the accessibility toilet for persons with disabilities as a separate gender neutral cubicle was not noticed. And a separate toilet for women with disabilities in the female toilet block was often not recorded, especially in public spaces. And then whilst there are ramps for persons with locomotive impairments, the same was not seen for persons with visual impairments. So there were no tactile signs that were observed in any of these studied toilets. And access to baby changing stations was nowhere seen within the community toilets as well as the public toilets that we have seen. No separate space for a mother to breastfeed her children was noticed in any of the toilets that we have studied. And another component that was also found to be a weak link was that there were no child-friendly hand washing stations. And whilst majority of the studied toilets had child-friendly toilets, for the name of it, the usability or the technology that was instated in place was that similar to the adult toilets, and there was no difference that was noticed within them. So despite one key finding for us here was that despite the physical presence of accessible toilets, there is a lot of work that needs to be made to make sure that they are accessible in practice, especially for transgender persons. Next slide, please. And when we went on to also look at maintenance and management, this is the component where we try to look at why there has been low usage of community toilets or public toilets, or what are the issues that are often faced by the users whilst using the community toilets and public toilets in different locations. some of the key findings for us was that, number one, it has been indicated to us that there are caretakers at almost all the studied places. But one thing is to be noted is that it is often the presence of a male caretaker and not a female caretaker, which puts the women at in an uncomfortable position and makes them want to not use the toilets despite their need for it. And another component was that there was no toilet cleaning schedule that was present. And even if it were present, there was no rules that were being followed in order to clean the toilets. And one other key component that we've also noticed was that the caretaker of the toilet, who was supposed to be at the entrance and make sure that the persons entering are paying their fees and they are entering the right cubicles, was often the cleaner as well. So there were times when the caretaker was busy with cleaning the toilets and there were nobody to take care of the entrance of the toilets. So, and one of the other key things that the caretakers had also indicated was that they were provided with cleaning materials by often the municipality in the location, but that the amount of cleaning supplies that have been provided are very inadequate, and that the cleaners often have to take money out of their pockets to be able to keep the toilets tidy. And when they do not have the money to spend on it, that is when the prevalence of unclean toilets is very highly seen amongst the studied toilets as well. And a couple of caretakers have also indicated that the solid waste from these toilets is often disposed of at a larger waste disposal box at the front of the toilet complex. But there have also been instances wherein this solid waste has been burned right next to the toilet complex, which is a potential hazard to the public health. Next slide, please. And these are some of the key reflections that have come out from the assessment, and the broader assessment report covers a wide variety of all the 6 indicators that Meenu has mentioned. And a couple of reflections that I would like to point out before closing this is that whilst the user experience of especially certain sections of women that we have surveyed spoke volumes about the plight and the impediments in using proper facilities for various reasons, especially linked to their vulnerable social location and the nexus of deeply rooted class differences for their ability to access basic sanitation. Another component was also that this female-friendly toilets guidebook has helped us identify these different needs. And if it weren't for that, we wouldn't have probably been able to go into the nitty-gritties of the different components. Maybe perhaps we would have been able to look at the broader 6 components, but within each of them, the different criteria that needs to be looked into was only done with the help of the particular guidebook. And the assessment report that we have seen is also adapted a little bit in a way to ensure that we meet the requirements, that the guide meets the requirements, or the questions in the survey that meet the requirements of and the needs and points in the right direction of the users. So there have been slight modifications that have been made to the guide that was followed, but predominantly it was exactly used. What we have assessed was basically based on the female-friendly toilet guidebook. And one key thing that I would like to suggest for anybody who would want to use female-friendly toilets guide to assess the situation within their own localities is that it's important for us to consider the socio-cultural components and the sensitivity that is associated with it, because toilets and sanitation, especially when associated with women and specifically menstruating women, is often looked at as a taboo subject, especially in countries like India. So it is very important for the surveyors and the researchers to be able to keep the sensitivity component in mind and be able to address and look at the questions in a way that it is not looked at in it is approached in a sensitive manner, but also trying to get the most out of it. I would like to conclude here, and thank you so much. I'm happy to take questions at a later point.
Brilliant. Thank you so much, Amulya, and thanks for really highlighting those issues of safety. And I think at the end there as well, you kind of hinted at how we have to ensure through the assessment itself, we're very aware of safeguarding, and that through the assessment and our contribution, we're also making sure to do no harm, both in how we ask the questions, but also in sharing the information we collect. We also need to respect the confidentiality of some of that information too. So everyone, we're back to Menti, and Minu, what's the next question?
Thanks, Therese. So coming back to Mentimeter, hope everyone has come back to the website or on your phone again. We have the second last question of the day, question number 6. So on a scale of 1 to 5, with 1 being not at all and 5 being absolutely, how safe do you feel using public toilets? This is not related to COVID safety. So if you can just log in and you'll see the questions there. On a scale of 1 to 5, with 1 being not at all and 5 being absolutely, how safe do you feel about using public toilets? I can see some answers are coming in.
Interesting. So, I mean, it's very interesting to see here that male respondents equally, you know, don't feel that public toilets are also unsafe. The experiences of the female respondents are quite variable, but clearly we're not anywhere near having absolute confidence in public toilets, but rather somewhat midway. And we also have one respondent, non-binary or other gender, and feeling not at all safe. So
I think it is also as if you don't click skip to the cases that don't apply to you, then it stays like a 1. So I think that's also what
I see.
The result.
Thanks, Andrés. Yes, you can skip the questions that aren't relevant to you on this one, but I think still, you know, I think people can really identify with the topic, and that this is something that is relevant to everybody, and so you know, it is a high priority, even though it's often not seen as such. So what can we do about that? We'll be getting onto that in our discussion after our final presentation from Bangladesh, which will then be followed from reflections from a government official from Bangladesh as well. So I would like to introduce now Mahfujur-ur Rahman from WaterAid Bangladesh. He's a project manager at WaterAid Bangladesh and leading a consortium of 14 organizations for a horizontal learning initiative in collaboration with the National Institute of Local Government. And Mahfuz is an equity and rights specialist. Over to you, Mahfuz.
Thank you, Therese, and thank you everyone for joining such a nice discussions. And also thank Amulya and Govind and Priya for sharing very insightful discussions and findings of the assessment. I should not go this assessment further because that would be repetitions. I just like to focus on a very few specific actions that we have undertaken based on this assessment and gender equality point of view. Back in 2011, I would say the landmark study what WaterAid has conducted on public toilet, and which reveals that this is very inadequate for a large number of people living in Bangladesh. And we conducted a public toilet study for the mega city, Dhaka City area, and we found only 47 public toilet functionals out of 90. So this is very clear, and what other colleagues shared for their own country, India, Nepal, this is also very similar assessment in Bangladesh as well. And every day around 10 million people actually passing through different to various purposes, and the needs public toilets. So this is very inadequate for a number of people based on their needs. And obviously, we didn't find any provision for women and persons with disabilities for these public toilets. There are some structures, but this is not women-friendly or disabled-friendly. And operational maintenance, this is the same like other countries shared, that very poor, and mostly applied management modalities was leasing out process, and that didn't work. These are the very common scenario when we started public toilet study and started our work on public toilets. Next slide, please. And what we are discussing around here, that we also conducted the second assessment, public toilets, and based on our guideline on women-friendly public toilets. And it was conducted in Chittagong. So this is also the same findings. Out of 52, we have assessed 45 public toilets. And this is out of 45, 5 was WaterAid supported toilets. So there is this clear distinction. The WaterAid public toilet has some features of women-friendly and gender inclusive. And we also conducted an accessibility audit, part of this assessment, and one of our DPO partner, B-Scan, they also conducted this assessment. And the most public toilets, what we found that it is not managed as reasonable standards, and basic hygiene elements were also missing, including hand washing facilities and regular cleanliness. And what we have quick win that we can actually accommodate the provision of cleaning materials and privacy features and menstrual health and hygiene management components in these public toilets. Next slide, please. We've started our first initiative with the government. We jointly started public toilet construction, and in 2014, we joined hands with Dhaka North City Corporation and Dhaka South City Corporation when I have an agreement to construct the public toilet, and they have also allocate lands and support us to demonstrate our model of inclusive model of public toilets. And then gradually we moved to Chittagong City Corporation, Select City Corporation, and Khumda City Corporations. And so far, to date, we have demonstrated 42 inclusive public toilets in 4 cities and under city corporations, including Dhaka North South, Khulna, Select, and Chittagong. And part of this scale up our inclusive model of public toilets, we joined hands with Bangladesh Railway, and already we had a partnership, and we have started constructing 3 new public toilets with very inclusive design, and we also incorporating all the findings and process of public toilets, which is women and gender inclusive and disability inclusive features. We have started with 3 new public toilets in the 3 major railway stations with the Bangladesh Railway, and as well as we also support technical assistance for the railways, Bangladesh Railways, to develop their public toilets in 50 railway stations across the country. Next slide, please. There are some key features of the public toilets what we have demonstrated in different city corporations and towns. And here I can say one important issue that we are not actually limiting this only for a public toilet, because this gendered inclusive model has also incorporated our work and thought process. And we have also incorporated this model in the education department. So we have constructed around 600 school toilets following this model, inclusive model with possible features and gender inclusive and also disability inclusive features and amenities. Not only that, we started a new partnership with the Ministry of Education as a part of the Madrasa and Caregivers Education Board, where we also demonstrated a new inclusive toilet models. And the key feature of our public toilets, what we have learned that the major obstacle was the accessibility issues. So we are very much concerned about this accessibility. So we incorporate special arrangements for persons with disabilities, children, and as well as elderly people in this particular process, particular toilets. And we did it reasonable accommodation. And based on the situation and the availability of resources and the space, we developed all the designs. It is not very common or prototype model of public toilets. We develop all toilets based on the available space, resources, and arrangements. And we already incorporate and very intentionally incorporate gender lens and gender sensitive issues. We also incorporate and consider. And basically it is...
You have 1 minute, Mahfuz.
Yeah, separate arrangement for male, female. We have incorporated breastfeeding corner, menstrual hygiene management components, and also deployed female attendants because female are very much comfortable with this. And security issues is one of the main concerns. So we built toilets at the most visible and crowded place to reach out to the maximum number of people and also women. And uninterrupted electricity supply, we also ensure. And also we ensure 24 hours attendant, both male and female. Lockers also available, and also CC camera surveillance, we also incorporate. And hygiene component, we incorporate running water facilities, soap, tissue, sanitary napkin, and required materials for available of these toilets. And also we incorporate safe drinking water dispensing systems. Next slide, please. I just look a few designs after and before scenario. So it is the toilet, public toilets, old toilets, and we developed this one, the right side hand. This is also we demonstrated in Select and also Chittagong. Next slide, please. This is also another toilets before. It is also Dhaka City. It is also before the public toilets was there, and then after the we construct. This is a feature of the inside of the public toilets. You can see here we have the spatial arrangement for disability. We have women attendants. We have separate spaces for breastfeeding corner and hand washing facilities. Next slide, please. Not just stopping here, we just would like to share a few things that we have already introduced public toilet apps to reach out the available public toilets across the country. So you can reach out every available toilet when you are traveling on roads. It is a Bangladesh public toilets apps we have also introduced in 2018. And we also support Dhaka North City Corporation and South City Corporation to develop an operation and management guidelines for public toilets. It's also in practice. And very recently, we also are supporting LGD, or the local government divisions, to formulate a national public toilet construction, operation and management guide policies. It is underway. So not only in developing such good structures, we also facilitate the process to make the toilet inclusive and for accessible for women, the half of the population of the country. Next slide, please. So that's all from my end. So if you have any questions, then we will very happy to.
Brilliant. Thank you. So as Mahfuz was sharing there, All of this work has been done in partnership with other stakeholders, and of course, you know, one of the most important stakeholders with a role to play in this is the government. So we're really delighted that Dr. Tariq Bin Yousuf has joined us for this session. He is the additional chief engineer at Dhaka North City Corporation and a civil engineer with a PhD in civil and building engineering. His work incorporates project and infrastructure management, solid waste management, sanitation, climate change, and disaster reduction. So he's a very busy man, and we're very delighted he's joined us now to share some of his reflections. So Dr. Tariq, I'd like to invite you to open your mic and turn on your camera, and perhaps share with us your reflections on the findings from the assessment, and subsequently the plans from Dhaka North City Corporation to address these issues of inclusive public toilets. I can see that Dr. Tariq was there, and as I introduced him, he slipped off. So I'm just wondering, Mahfuz, are you able to just reach out to Dr. Tariq and see if we can get, yes, I can see he's now rejoined. Dr. Tariq, would you like to open your mic and camera?
Okay. Thank you, everyone. Suddenly, you see, I was disconnected. It's okay. So, thank you, everyone. I was enjoying all the presentations, and you see, all the presentations are very good. You see, I can say that from the day one, I'm involved with the public toilet facilities, and also I can say that all the public toilets that so far we have built and maintained are female friendly. It's okay. And the key features that presented by Mr. Mahfuz, we are maintaining. So with the support of WaterAid, see, from 2011, we have started the mission making public toilets in Dhaka City, and it has becoming a revolution in the Dhaka North City Corporation. So with the support of WaterAid, we have already constructed and operated 16, number 16. So okay, then with the support of World Toilet Association, we have constructed 3. And another organization, social marketing company, they supported 1. And from DNCC, Dhaka North City Corporation, we have already constructed 35 numbers, and we have a target of 100. So the fund and the construction and the capacity is not a problem. As well as you see, as Mr. Mahfuz here already discussed regarding the operational guideline, and we are following these operational guidelines and also the standard that has already been established. So we are maintaining that standard for the public toilets. But the main challenges that we are facing is the sustainable operation of the public toilets, because you see, we are charging some, you see, the service charges, but that is not sufficient to run such kind of, you see, the sophisticated operation and maintenance, because for the public toilet, we have cleanliness of the public toilet. So for that, there is a need of support, financial support for the operation. And our mayor, he's very much positive to give all the support that's why I can say that, you see, on 18 November, you see, for the World Toilet Day, you see, WaterAid also organized another, you see, the meeting where our mayor has joined, and he committed that he will give support for the operation of the maintenance, the kind of, you see, the indoor or outdoor advertisement, and also the cafe or ATM booth or laundry service, this kind of good practices that exist in different cities. So he is committed to give the support to run the public toilets in a very efficient manner. And we are also, you see, encouraging the private and corporate sector to come forward to support this. So far, you see, the Rotary International, they have already joined. So he's also very much, you see, supportive to bring the private and corporate agencies in this mission. And also I need to add another issue is that, yes, already we have constructed around 60 public toilets, and in all the, you see, the parks and playgrounds, we have already constructed the public toilets. And we are now ready to hand it over to the different, you see, the NGOs as well as the private sector who wants to run this public toilet. So in that case, another issue is that it's very difficult to get land in the city in an appropriate, you see, the location. Other issue is that the, you see, the fecal sludge management of the public toilets is okay. Most of the public toilets are located where there is no pipe sewer system. So on-site sanitation system is only the way of emptying the, you see, the septic tanks. So we'll have to look into the full value chain of the public toilet. So another issue is that, you see, for the community toilet, yes, we are working with the different NGOs, those who are looking into the community toilets and where there is a separate facility for the female. So far, you see the standard guidelines that you have prepared, and I have gone through the technical guidelines, and I have found that, you see, most of the features that we already incorporated and we are maintaining. Thank you.
Thank you so much to Tariq, and really, really great to hear from you as to some of the challenges faced by government and your efforts to really engage so many different stakeholders in order to ensure that there are sufficient public toilets, that these different models of management are really critical to bring people in, to provide as many toilets as necessary, but also a really good understanding of what is required to make them female friendly and accessible, and integrating that into guidelines and regulations. So we are moving now onto Q&A, and we've had a number of excellent questions posted in the chat box. And so perhaps I could start with three of those questions. So one has been posed around, has any monitoring and evaluation study been done on usage of the public or community toilets? And perhaps related to that, another question, which was about the systems used for getting feedback from users. So perhaps we could hear, Mahfuz, I believe you have done some monitoring of usage. And if any other colleagues would like to also respond in terms of user feedback, please raise your hands and I'll come to you. Mahfuz, could you respond on how you are monitoring usage of toilets, public toilets? Okay.
Can I answer the question?
Yes, please go ahead.
Okay, that's fine. You say it's a very important that how we are monitoring the cleanliness of the public toilet. It's okay. So you see, all the public toilets, you see, the monthly report is submitted to the city corporation, as well as we have a, you see, the it's a Shobar Dhaka apps, that is Dhaka is for all apps. So where there is a system of the complaint, it's okay. So when we receive some complaint from the public, just straightway we communicated with the operators. It's okay. So this way we are working, and also you know that every year there is a audit of all the public toilets, and we have a two committees are already formed and they are working. One is the advisory committee, another is the, you see, the public toilet management committee. It's okay. So, and the local ward councillors, they are involved in these committees. So always, if there is a, you see, not proper management or something like that, we get the complaint and instantly we, you see, try to resolve the problem. Thank you.
Thank you very much. Amulya, do you want to add to that as well from India experience?
Yes. So I would like to add a couple of components that are already in place and the efforts that are being taken by the municipality and the government side, and some of the proposed monitoring and feedback mechanisms that WaterAid India is planning to instate, because we are still in talks with the municipality and everything to take this further and to scale up the efforts to make sure that the community and public toilets in the city are more female friendly. So as part of that, we are also trying to put together a small reference book as to what are the different things that could be put in place for this. So one of the first things that has been instated across India is that the government has prioritized these feedback boxes. So these are primarily electronic feedback boxes that have a grading of very bad, bad, average, good, and very good. So a user, after using the toilet, can just go and press on that particular thing, and then they would be able to know which, then the municipality or the respective caretakers will be able to see what has been the predominant feedback for this. But oftentimes, one of the things that we have also found out during the assessment was that either these electronic feedback machines were either broken, or they are under maintenance, or they're not being used, or the caretakers do not know how to use, and neither do the users. So there are some gaps associated to it. So as part of that, capacity building for the caretakers is a very important factor moving forward to ensure effective maintenance of the works that are being in place. So as part of our next steps, we also plan to organize trainings and capacity building sessions for specifically focusing on the caretakers and cleaners, as well as the municipality authorities who are involved in the relevant works.
Thank you, Amulya. So I have another question now, and I wanted to put this question first to Govind in Nepal. What are the challenges and opportunities to move from having female-friendly toilets to ensuring throughout a given city there's proper access to such facilities through identifying and addressing gaps in unserved areas. Govind, could you respond first to that one? And again, if other colleagues would like to add, please put up your hand and I'll come to you. Govind, over to you.
Okay, thank you. Thank you for the question, Therese. And the first and what very most important thing is that, the number of toilets is the key. Number of toilets, availability of public toilets is a key issue, key challenge, and the second one is the capacity and understanding of the public toilet builders is another key issues. Who designs public toilets is another issue. These are some of the issues, and the capacity of the technicians also who produces, who build public toilets. These are the key issues. That's why the most important the opportunities to address these challenges are to have a kind of good conversations among key stakeholders, from policymakers to decision makers to technical experts to stakeholders and users from different communities, mainly among persons with disabilities, girls, women, could help build understanding what is gap within themselves and find a solution by themselves forward. This could be one opportunity. Is definitely this is the first opportunity, and the most important thing is that unless we don't have good policy and guidelines and standard at the national or sub-national level, we cannot monitor. We cannot have a kind of good monitor on the status of the public toilets across the country in all the cities. This is the one thing, and another is monitoring mechanism. I can simply say it as a kind of how system building blocks for these public toilets are in place from national to local level. I mean policy and practices, monitoring, financing, capacity building. We have to look from these aspects. These are the opportunities for all the stakeholders, from government to civil society and externals. Thank you, Therese.
Thank you, Govind. So just wondering, would any colleague from India or Bangladesh also like to respond to that question? Or I can move on to next question. I saw one just come up in the chat box, which is around whether planning for toilet construction was more demand-driven or service-driven. So to what extent have local community been involved in planning for toilet locations and styles, etc.? And perhaps particularly there, from the community, ensuring voices of women and people with disability, etc., are very much part of that consultation. So perhaps we could hear from each of the three countries on that one, and starting with Amulya.
Right. Thanks, Therese, and that's a very important question that has been raised. So I would need to deviate a little bit from this to be able to answer that, because the toilets that we have assessed as part of this assessment were the public toilets and the community toilets that were previously constructed, mainly by the municipality of the city. So there hasn't, and these have been, some of them were old and some of them were relatively new. Amongst those that were relatively new, and this assessment was carried out last year, so those that were carried out, constructed a couple of years ago or so, had more so engagement, especially with regards to community toilets. With public toilets, it wasn't necessarily the case. The public toilets were more so designed in the transit spaces and especially government spaces. So the decisions have been predominantly taken by the municipality and the relevant officials themselves. But with regards to some of the community toilets, the community was at the forefront to decide what is it that they require, or how many households could come together and use one particular toilet and everything. But that wasn't the case with all the community toilets that we have assessed. It was a very rare case. But I will just deviate a little bit and go into some of the works that WaterAid India is doing with regards to ensuring female friendliness in public toilets and community toilets that are being constructed from our end by following the guidelines of the female friendly toilet assessment. Is that community interacting with the community members, specifically for community toilets with persons with disabilities, transgender persons, elderly persons, as well as all the marginalized, specifically the most marginalized and vulnerable populations who are often left be a priority. Why these decisions, or this starts before the pre-planning? This starts as early as the pre-planning stage, so that we can actually decide what needs to be prioritized, what is the need of the community, or what is the need for them. And similarly, with regards to public toilets, we are carrying out some surveys or some sort of data.
We're struggling, unfortunately, we're struggling with your connectivity, Amulya, and sorry we can't hear you clearly. Unfortunately, I also need to bring our session to a Amulya, unfortunately, we can't hear you.
What their requirements are, and also going and interacting with the municipality officials to understand what are the predominant requirements. It's a lot of work ahead and something that needs to be prioritized moving forward further. Thank you.
Thanks, Amulya, and apologies for the disturbance on the audio there. But unfortunately, we are out of time as well. So we just want to wrap up the session. Thank you, everybody, for your questions. We would now like to very much hear your thoughts and ideas as well. So we have one final Menti question, and then a few words just to conclude from another colleague. So Minu, over to you with the Menti.
Thanks, Therese. The last Menti exercise of the day, question number 7. We'd like to hear everyone on what is your idea for how we can ensure women can always find and use public toilets with dignity and without worry. So everyone, let's hear from you on your ideas. How can we ensure women can always find and use public toilets with dignity and without worry?
So one excellent response there at the beginning: ensure women are consulted properly. Oh, now we're getting some answers. Yes, hear concerns and demands, and I think really get those voices heard. Sufficient funding and implementation. Also in the chat box, really understanding this is a matter of human rights, ensuring infrastructure quality, following a lot of those principles and key features of female-friendly toilets, clean, well-maintained, proper signage, sensitivity to women's needs, more women in decision-making positions in city planning, fantastic, sensitizing caretakers, separate section for women and children, ensuring security, fantastic. Let's just take a few more. How can we really get this on the agenda as well? When we had, what are the challenges, prioritization or lack of prioritization came up. Some of those underlying issues around gender inequality and patriarchy were mentioned. How can we really address that in relation to ensuring female-friendly public toilets? Yeah, ensuring the infrastructure is suitable. Okay, brilliant. Thank you so much, everybody, for your contributions and answers there. I'd now like to hand over for a final word to my colleague, Andrés Hueso, who is the Senior Policy Analyst for Sanitation at WaterAid and our Global Policy Lead on Sanitation. Over to you, Andrés, to please share some of your reflections on this session. And I think you can move on to the last slide, Minu.
Thank you, Tess, and thanks to all the presenters and also the participants for a really engaging session. And I think some quick thoughts from my end is that I think from the first Menti we have seen that the provision of public and community toilets is really important, that it impacts women across countries and across income levels. And I think it's very clear to all of us that this requires urgent action. And we have learned a lot from the different experiences, from the guide, from the implementation and the influencing in Nepal, in Bangladesh and in India, and from the experience in particular in Dhaka City. We have lots of insights in terms of how this can be done and what are the lessons from trying to bring about some of these changes. So I believe we can say we now have the framework, the guidance, and we have a lot of experiences of applying it in many countries. So I think this lays the groundwork, and that it becomes a really important platform that we can all use in our future projects, in our conversations with government, our discussions with partners. And I think there is a first level that we should all ensure happens, which is that we shouldn't ever see again a gender blind public or community toilet being built. I think the effort to, once you are starting a new infrastructure, to make it female friendly is very little, and I think it's very important that doesn't happen, and that all future public and community toilets are female friendly and accessible. And we haven't talked about that, but I think the same applies to schools, the same applies to healthcare facilities or toilets in institutions. And I think it's a very small but very important change. So that to me would be the first level of urgent and action that shouldn't wait. And then I think there's a second level, which is about including this into citywide inclusive sanitation or city planning, so that we don't just look at the toilets that are already there or the toilets that are going to be built, but that we think about it from a citywide perspective and look where there are gaps, where there may be the lack of public toilets or community toilets may be affecting women's decision to write to the city, and trying to extend that coverage and close those gaps. And I think finally the other thing that came out throughout the presentation also is that cross-cutting, so for both levels that I've mentioned, there is the challenge of the financial sustainability and the adequate maintenance and operation of these facilities. And I think my reflection there is that there has been some examples shared in terms of how to increase the efficiency or some ways of innovative financing, having support from the private sector, having NGOs help to run it. And this is all important and things that we should continue exploring. But I would also like to remind all of us that, as has been mentioned also in the chat box, that sanitation is a human right. It's a commitment also that many countries have made as part of the Sustainable Development Goals, and it's a public good. So I think we shouldn't forget that there is a case and there is a need for public funding to close any gap between this efficient, the running of these efficient and facilities, but there may always, in many cases, be a gap to ensure the financial sustainability, and I think that should be closed through public finance, which will also be critical to ensure equitable access. So that also in places where it's less profitable and where people may need it most, that access is there. So those are some quick reflections from my end, and thanks again everyone for a very useful session. Thank you.
So thank you, Andrés, for summing up so well there, and to all the speakers and participants. I'm sure through the forum we will be sharing contacts and resources that we've also put in the chat box. So we look forward to hearing from you with your efforts as well to support female-friendly and inclusive public toilets everywhere. Thank you very much. Have a fantastic evening or rest of your day. And thanks once again to the ADB Gender Forum.